right, and welcome everybody. And thank you for coming and tuning in from all over the world tonight or this morning or wherever you are in which time zone. Welcome innovators. We are so excited to have you here in our first ever virtual hackathon here at Yale. So first of all, some quick housekeeping items. Please change your screen names if you haven't already to your name followed by your Discord username and your 4-digit tag in parentheses. The example is down below, and you can look at other people in the Zoom meeting that have that. We are very excited. My name is Dr. Rosenthal. I'm a primary care physician and on the faculty here at Yale School of Medicine. And I'm one of our clinical directors at the Yale Center for Biomedical Innovation and Technology. And we are thrilled to have you here today. Next slide, please. We are broadcasting from Connecticut here, where it is nice and cold. Our hope is that some of you are in nice warm climates today. So today and tomorrow and Sunday, this weekend, is our 2021 annual hackathon. And we are so excited to be doing this virtually this year on big data and real world evidence. And I'll just point out a couple of our tracks, our 4 tracks that many of you have already been to the website and seen, are medical sensors and Internet of Things, clinical trials, economic forecasting, and epidemiology and disease modeling. Incredibly important topics today as our globe faces a global pandemic. And I'm sorry, Toronto is negative 11 degrees. Thank you very much for that. All right, next slide, please. So as I mentioned, this is our largest hackathon by about threefold. We have over 575 people who are participating, who have registered. There are at least 116 from the Yale ecosystem. We have 260 unique institutions represented, as well as 228 first-time hackers. We're excited to welcome the hackers you'll hear all about tonight, about what this weekend involves. We have an astounding 34 countries represented. We have every continent represented except for Antarctica. 50% of the group is international, which is just a fantastic thing. And we're excited to be doing this virtually with all of you around the world. In terms of backgrounds, who you all are. So you can self-identified from the forums, about a quarter of the people are business background, some designers, about 25 or 30% engineers and healthcare focused, about 40% are programmers, a little less scientists, and then the vast majority, 75% of you are students as participants. Our top represented schools, Yale is as the top at 71, but go Georgia Tech with 20. The College of New Jersey is here. The Borough of Manhattan Community College is here, and the University of Florida as well. And please put in all of your, in the chat room, feel free to place where you're coming from. We love seeing that. Next slide, please. So, okay, so what is our agenda over this weekend? So we're so excited for the kickoff event tonight. You'll hear from our keynotes tonight. We have 2 outstanding keynotes, really spectacular, who have joined us, and you'll hear about them. I'll introduce them in a little bit. We will then just take a quick 10-minute break after the second keynote speaker, just so you can have a slight break there. And then the pitches will begin. So the pain point pitches will begin. Some of you have already been doing that in the Discord. I saw a bunch of people already saying what they want to be working on a little bit in the Discord links. And our hackathon committee, which is made up of students and staff from Yale, will be helping to explain sort of how that situation goes and the logistics for the rest of the night. On Saturday is going to be mostly pitch review and additional pitches in the morning, as well as team registration. So really making sure that those teams are registered in terms of how you found people, as well as sort of the mentor genius bar signups and floating mentors. Saturday is all about hacking. So you'll have all of that. And there's some wonderful events in the afternoon, some fireside chats if you need a break from hacking that you can tune into. Sunday will be another sort of floating mentors, and Genius Bar will explain all of that again. Your presentations will be due at noon on Sunday, high noon, and then they will be judged in the afternoon, and the winners will be announced at 5 p.m. Eastern time zone, and the closing ceremony on Sunday. Next. So what is CBIT? So who are we? So the Yale University Center for Biomedical Innovation Technology is an interdisciplinary initiative to foster greater innovation in healthcare technology. It is a consortium of engineers, clinicians, scientists, innovators, and entrepreneurs to help incubate, support, and potentially bring to market novel technical approaches to address undermet clinical needs. And our mission is to educate the next generation of biomedical innovators and maximize impact. What we offer at the Yale School of Medicine is professional and personal empowerment, expert mentorship, and impactful connections. And we're excited. The hackathon is just one of the things that we do. This is our big annual event, and we're really excited to be able to have so much representation across the entire globe today. You can connect with us on Twitter, on Facebook. So our leadership in terms of the CBIT, so our co-founder, Dr. Mark Saltzman, is a professor of chemical and engineering and physiology and biomedical engineering at Yale. Michael Dempsey and Christopher Luce are our co-executive directors. Margaret Cartier is our innovation director. I'm a clinical director, and our operations manager is Michelle Nantel. And one of our other hackathon leads is Jody Knapp, who's doing all of the behind the scenes work today. Next. Okay, so what is a hackathon? We have about 228 new participants in a hackathon. So what the heck is this event? You've all signed up for it. And I will say it's an event in which people with diverse perspectives, such as all of these people, clinicians, engineers, designers, students, users, patients, come together in sort of an intense, fun-filled 3-day weekend to develop and build solutions that could address challenges facing healthcare today. You all will form teams, you'll collaborate, all electronically and virtually this time within a very limited time frame, and focus on a specific problem or an idea in healthcare to come up with innovative ideas and solutions. And what I will tell you is I had never heard of one until a couple of years ago. In 2018, I participated in this one, and it was such a wonderful experience to meet such wonderful people and come up. It's amazing what you can create in 24 hours. The process itself, you'll hear tonight, is a little bit about, initially you're going to pitch problems, not necessarily solutions, but pain points that you see or that others have. Then there'll be this wonderful mixing that's going to happen tonight about sort of ideas and about trying to teams will form. And then all day you will hack tomorrow. You'll get feedback from mentors and experts that we have. We have about 50 people who have donated their time, who are experts in different fields, to come and give you feedback on those ideas and steer you in the right direction, and iterate on that over and over again until Sunday when we pitch. Next. So our hackathons to date, this is our 8th, I believe. This is the first ever virtual hackathon. It's our highest enrollment ever. Usually in person, we have about 300 applicants or about 200 participants at a time, often 20 projects with oftentimes 50 or 70 mentors in person. And generally it's more Yale than not, but this time we have much more global and other places represented. I will say last year's themes, so last year was social determinants of health. The year before that was genomics, the next frontier of personalized medicine. And the year before that was AI, enabling medicine and patient experience. Next. We are very, very grateful to our sponsors. This year's current sponsors: Verana Health, the Yale School of Public Health, the Yale School of Medicine, CIMIT, which is the Consortia for Improving Medicine with Innovation and Technology out of MIT, and the Yale New Haven Health System. You can see some of our past sponsors as well. So we're going to hear from first our 2020 hackathon winner. I have privileged to introduce Dr. Jasmine Weiss, who is a second-year national clinical scholar at Yale, and she's going to tell you about her experience from last year, I think her first hackathon ever last year, and diversify. So Jasmine, feel free to unmute yourself. Welcome.
Thank you, Dr. Rosenthal, and thank you for having us join today. I'm excited to share what Diversify has been up to. As you see, my teammates, Shrey, Wise, Afash, and Rohan, we all met last year at the Social Determinants of Health hackathon last year. And it was a great opportunity to not only connect with individuals who were interested in solving big healthcare problems and thinking about how cultural sensitivity is important and how increasing representation in medicine is important, but to really shape the idea and develop the idea over the past year has also been extremely exciting. And so next slide, please. So during the past year, we've had the opportunity to connect with educators, with healthcare professionals, and with individuals to create an online platform called letsdiversify.com. Next slide, please. And so our mission is really to connect historically underrepresented students across the entirety of the academic pipeline. And we want to connect them to healthcare professionals and institutions to really promote diversity, equity, and inclusion in the healthcare workforce. So for middle school and high school students, we're having virtual role modeling experiences and sessions with middle schools and high schools. And then for medical education, we plan to launch the platform where students and applicants interested in medical school, residency, and fellowship can really engage with these institutions in real time in a longitudinal fashion. So definitely visit us at letsdiversify.com. And thank you again for the opportunity to form at the hackathon and then really blossom from there.
And we'll start. So we are very excited, and I apologize for those delays, but you know, that's showbiz, right? So we are super excited to have our keynotes, and and our first keynote really needs no introduction. You know, Karen DeSalvo, but I'll give her one anyway, is currently the Chief Health Officer at Google Health. Karen is also an adjunct professor at the Medicine and Population Health at the University of Texas at Austin Dell Medical School and senior fellow at the Bipartisan Policy Center. Her biography is on the website. There's tremendous amounts of things. A couple just quick notes. She's a general internist. She's currently the president of the Society for General Internal Medicine. And I want to say a couple things. She really did amazing work in the world of public health and primary care when she was in Louisiana, putting back to the health system after Hurricane Katrina. And then in the Obama administration, she was the Assistant Secretary for Health, as well as the National Coordinator for Health Information Technology. So she really spans the gamut of both IT, technology, medicine, primary care, and social determinants of health, as well as public health. And we are just thrilled to have her coming here to speak to us to Yale. And Karen, just in case you can hear us, looks like there's 190 participants here. We have about a 50% international audience here today, about 75% students. We are just thrilled to have you. I'm sorry about the technical difficulties getting in. Hopefully you can hear me.
Hooray!
All right. Sorry about that.
No, it's okay. You know, everyone in the world uses Zoom all the time, and we use our Google Meets. And so for some reason, this one I tried all kind of back doors. But anyway, I'm with you telephonically. David, I'm very sorry to push back your time. And Harlan, I'm sorry that I'm pushing back your time.
No worries.
How would you like me to proceed? Just to jump in. I think y'all can see the slides. I believe Lauren's presenting them for me. Is that right?
Yes, we can see them.
Okay, good. Well, let me just jump right in. Thank you so much for having me. Thank you all for the work that you do at the intersection of health and technology and public health. And I just thought maybe I would walk you through what's been happening over here at Google for the last year since I joined the company. And I want to spend a fair amount of my time talking about how we've been working on, let's see, I'm trying to, this is going to be interesting. We'll go to what I think is the third slide, Lauren, which talks about the mission.
Yep.
Great. So I joined Google about a year ago to be a part of Google Health, which is an effort in the company that is aiming to elevate the mission of organizing the world's information and make it universally accessible and useful, which is Google's mission, but insert health into that so that when people want to have access to not only their own health information, but those kinds of questions that we have billions of people asking us every day about their daily lives on our various surfaces like search and maps and YouTube, we're able to empower people with the best information possible to make healthier decisions or to understand how to navigate the healthcare system. Next slide. I'm having a cognitive issue here, David. I'm sorry. We're having as I mentioned, Google is a place that people naturally come for health information. And having spent a lot of my life in the practice of medicine or the practice of public health, it's very often that we're trying to put forward health information to the public. Certainly, even as national coordinator, we want to give people information about where they're going to find that important information to help navigate that journey. And in fact, they're coming to places like Google every day. So as we stood up, next slide, Google Health, it was important for us to understand about how to do that work, but I'll just tell you a word about the broader efforts that we have here at Google Health. The first is, of course, that we want to identify, develop, and evaluate new opportunities for Google technologies like artificial intelligence to not only preserve life, but to improve healthcare that people receive all over the world every day. The second big area of work that we have in Google Health is to enable better care for patients by giving teams information and tools they need to deliver better, faster, more connected care. This is something you all may have seen talked about, where we are working on basically a health search tool that sits on top of electronic health records, and some other ways that we're trying to give superpowers to clinicians in the clinical environment. The third area is work that we've done in increasing accuracy and availability of imaging and diagnostics information, whether that's retinal scans or mammography or pathology slides, leveraging AI as a tool for diagnostics and we hope over time more and more for therapeutics. And finally, the area I'm going to spend most of my time talking about today, which is to empower people to be healthier with the information, assistance, and connections they need to take action. Next slide. Shortly after I got here to Google, the pandemic exploded on the world scene. And as early as January, Google began to put forward information that would allow us to provide high quality information to the world about what was COVID and what did they need to know to protect themselves and their families. Next slide. The work of the pandemic was necessary and we had to lead in to do it, but it was also an accelerant for much of the work that we already had on our plate around how to leverage AI or how to improve authoritative content environment so that the world not only in this pandemic could find information, innovate, collaborate, deliver solutions, but do that with a focus on the COVID-19 itself. Next slide. This is a high-level overview of a few months of work and a few of the key product areas where we've leveraged data that we have or resources we have in Google to be able to help partner with the public, with public health, and or with the healthcare enterprise. Next slide. Job one in anything like this is communicating the right authoritative information to the public so they know how to protect themselves and their communities. We surfaced authoritative information on our search platforms, and that takes different forms. Sometimes we create a custom-built search experience, this COVID-19 landing page, where we can pack more information about and content and data about the pandemic itself. We also take the opportunity to have what we call an OSERP, which is basically a landing page. When you search on something like coronavirus symptoms, it will lift up information that you see in this right panel of what is COVID, what are the symptoms, how do I prevent it, how do I treat it. All this information is generally derived from authoritative sources like the World Health Organization or the NHS or the CDC. And we package that up, and we also provide blue links or directions to get people to those authoritative sources. We not only work globally, but over the course of time, get more granular to try to help people when they're searching in a certain geography, like say New Orleans, Louisiana, to get the most appropriate information from that geography where they are. Next slide. One of the other early questions that arose in the pandemic was how could public health authorities understand if the community was adhering to shelter-in-place orders. And gosh, it seems like a lifetime ago, but you all will remember that back in March when communities were asked to shelter in place or to go to work from home, I had colleagues in the public health community who were telling me they were peering out their windows in their offices to, hand count cars driving by to get a feel for whether people were staying home. And our public health and research team realized that they, in partnership with our MAPS team, could use a data set that we have already, which is a busyness factor, essentially looking at how busy a restaurant is, for example, or a retail place, and convert that into a set of reports, but then also a downloadable data set that could give near-term information to public health authorities to make evidence-based decisions and understand if people were responding to the shelter-in-place orders and where they might need to strengthen some expectations, say, in parks or playgrounds or on transportation. And this data has been used in a variety of ways around the world, and is built into what the CDC and our World in Data and the World Economic Forum use as part of their report outs, not only to look at the pandemic, but to think about the economic impact. Next slide. We also realized that we could do more with our sharing our search trends data, particularly thinking about COVID-19, but this data set has about 420 signs and symptoms that people would search on and perhaps related to COVID. You all might remember that the anosmia story, where early on some researchers realized that searches on anosmia could predict outbreaks of COVID in communities. And so we got real focused on making sure we could bundle up the health-related search queries in a way that would give year-over-year comparative data, so 3 years of comparative data by date, have a visualization tool to support reporting out if that's helpful, but also the data behind it so that researchers and public health authorities could take advantage of this to try to understand at a county level in the U.S., and now we have this in other geographies like the U.K., to think about what the community was asking in search. I'm just going to pause for a minute here to tell you, because this is relevant to the kind of how COVID helped us accelerate work we wanted to do, and this is one of them. One of the first things I asked the public health team when I got to Google was to help lift up the consumer voice at the local level for public health authorities. And they have, these teams here are so sophisticated in their research and their ability to apply AI to challenges. But even just having cross-sectional descriptive data at the local level for public health authorities, the only way I can get that when I was health commissioner of New Orleans was a really kind of clunky survey and some coffees and basements of churches, and we don't really have basements in churches in New Orleans, but you get the picture. It's a sort of a mixed methods approach, doing the best you can, because by the time the RFSS or other surveys would get to me, it wasn't what was on the community's mind. And so I'm super excited that the team's been able to think about this in the context of COVID, but hopefully it will continue to be useful going forward. Next slide. The data sets that I mentioned and other resources we have been making available. Cloud has a collection of these data sites that are available as part of our COVID-19 open data effort. This is an image of a training video, which will probably for this group of folks would be under your skill level, but perhaps not. And then the team tells me that this GitHub site is the best place if you want to navigate to access some of the open data that we've made available to the public, and we would welcome any questions or ideas that you have with respect to those data sources that we've been leveraging in public health and that have already been leveraged by the research and public health enterprises in the U.S. and around the world. Next slide. I want to give this example of how we've been working with the public health community on this exposure notification technology, which is something you may have heard of. We worked on with Apple, and in fact, Microsoft has been involved, because it's exactly the opposite of what I've described. It's an opportunity that our companies use to use technology in a way that would not allow us to collect data. So we were asked if we could help with contact tracing. And one of the ways early in the pandemic people wanted help was to use GPS or location tracking to identify people who might have been in close contact with someone who was COVID positive. But our engineers and those at Apple realized they could use Bluetooth Low Energy and had a way to dial that based on to look at time and distance exposure and allow that data to be captured not by us, but rather by the public health authorities. In an anonymous encrypted key server that would let your phone know if it was exposed to another phone whose owner had been determined to be COVID positive. And in fact, we're up to about 25 states. Louisiana announced today that they're turning on COVID Defense, which is our local exposure notification system. But we are in about 40 geographies around the world and starting to have some report outs from the data that's owned by these public health authorities to understand the impact of things like Does it shorten time to when people begin to self-quarantine? Does it help identify more cases or augment the cases that the human contact tracers are doing? And we're beginning to see and evaluate a story that shows that this is an added tool in the toolbox for public health. The NIH and others have been working with Google and Apple to understand how we could begin to build more rigor into this system in the U.S. And so stay tuned, because over time, some research institutions may have access to some of that data via the NIH and public health. But just wanted to highlight an example where we said we shouldn't have the data, and so we're not going to step into having that. Okay, next slide. I just then want to transition into giving you all a flavor for how, for us, this pandemic has, of course, been a public health priority, and we feel an intense responsibility as a company to get good information to the public, to public health, and to researchers, and to pull down this information. But it's also helping us think about how we can be helpful in non-COVID efforts. Next slide. And honestly, in many ways, it's really accelerated a work plan that we were already thinking through. So an example of this would be with screeners, where we partnered with the CDC, and we still partner with them. We just have a new update of, I think it's the 65th version of the COVID self-assessment that has helped to help people to navigate to the CDC website to understand if they may have COVID. And over time, we look forward to working with the CDC when they are ready to understand how that can help people know what their eligibility is for things like vaccinations. But I mentioned earlier some of the other screening tools that we had pre-pandemic, and we have continued to work on those during the pandemic. One of the most recent ones we have is a postpartum depression self-assessment, again, built off of known tools that are evidence-based and have performance characteristics that would meet a high bar that can help navigate people to authoritative content. So that's the sort of self-assessment component of the work. And the other is helping people navigate the health system. So we, early on in the pandemic, worked to do things like lift up telehealth options for people in communities, especially when it was spring and healthcare systems wanted people to navigate to telehealth and not arrive in the healthcare system. So we were able to use maps as an example when people searched on healthcare near me to make sure folks knew that there were other options that were virtual, and use that as an additional opportunity to work on lifting up transparency goals around the price point of some of the various telehealth visits, and begin to fold in options based upon insurance status, including Medicaid. And we'll continue with this kind of work with online healthcare, and of course also thinking about other ways people can navigate getting access to vaccination. I just want to end with a comment for this group about health equity and inclusion, because as you can get a flavor of as I raced through the last few months of the pandemic, all of us have access to big data sets. We can think of ways to use them for good. And I hope that we do continue to do that as a community. I think it's possible to do good and do well, though certainly for us right now, it's really a lot about doing good. But we've also, as a company, and I think all of us as a world, need to make sure that we're thinking through our responsibilities around health equity and inclusion as we build upon these tools. Next slide. Really, the work for all of us then is that every person should have the opportunity to attain their full potential, and do that in a way that leverages technology and digital tools from the 21st century to democratize access to not only quality healthcare, but to health. And I would just ask that as you all are in this field and working on leveraging a digital health future, and thinking about ways that we can use data and technology, that we're considering it our shared responsibility, that we're going to do that in a way that eliminates disparities in health and creates products that are inclusive, tools that are not going to exacerbate disparities. And as you all probably are already mindful of, you have to be very intentional as you're thinking about this across the product's life cycle. The pandemic has caused certainly us at Google Health to think in a more structured way about the work we're doing, whether it's in our AI models or tools, or in partnerships and relationships that we build. And it's one of the pieces of work that I own here in Google Health is our diversity, equity, and inclusion work. And I'm very proud of our clinical team and the way that we work with our end and PM folks to do good in that space. So lots of really exciting things that we've been doing at Google Health, trying to be a part of the greater good. It's a really wonderful time for you guys to be engaged in the work that you are. And I'm just really excited to have a chance to share some of our work, but also hopefully help you remember that as you do it, we need to do it with equity and inclusion in mind. And I will pause there. And if I have time for questions, I'll take them. But David, if you need to move on, that'd be great.
Thank you so much. So that's fantastic. Thank you very much. We have, I think, time maybe for 2 questions. I have 2. There's, and I'll be moderating them. It looks like there's one that I'll talk about is sort of AI and inclusion and ethics. And the other one is around sort of mental health now that work from home has become sort of a standard during COVID. But let's start with the question about AI and ethics. And I guess the question is sort of as, you're working in big data sets, this group is interested in big data and real world evidence. And as we use these algorithms, if we start with data that is essentially biased and not representative, it can actually exacerbate and worsen some of the ethical or some of the equitable issues. And so how are you thinking about that at Google and at Google Health?
Yep, I think the point there is so well taken. And it's one of the reasons I mentioned that we have to be intentional from the outset from ideation. And so, for example, it's pretty normal and natural, I guess, for researchers to have access to data sets, perhaps from big academic institutions, and or from other sources that may be not as diverse in a number of ways. And some of that is because of who's using systems. Some of that is because of who's allowing consent and access. So we think at Google Health that some of this just begins with partnership and making sure that we're partnering with organizations where we're going to have access to diverse data. I think more significantly probably, though, is also to make sure we're considering answering the right questions. And so what are the problems that need to be solved, not entirely through the lens of the baggage we might carry from our own backgrounds, but thinking about other walks of life and doing that with partners who are going to raise additional points of view about what might be important to answer or how we would interpret the results that we may be getting. Because the third point that I would raise is some data sets that we would have might point us to either overfitting a model, building it in such a way that creates bias. I think we've seen a lot of work or writings recently about some of the decision tools that are in the healthcare environment for end-stage renal disease or other areas that might interpret race in ways that would drive you to or cardiovascular disease, right? Might interpret race in a way that would drive you to a different care decision. On the other hand, sometimes that data is more helpful if we stratify populations and try to think about what are the other contextual characteristics that may go well beyond color, skin, or age, but have more to do with some of the non-medical drivers. So it's a very soup to nuts effort for us. We've done some writing on it, and David, what I'll do is share a couple of papers, one that the team published before I arrived, and then in the last few months on the heels of a prediction model that we built around future sites of COVID outbreaks. We wrote a paper on fairness as we were thinking about what was our responsibility and accountability, and how should we be thinking at multiple steps along the way of building AI models and other tools that are inclusive. I should mention, I mean, we have a formal director of product inclusion. We have a work plan around this, so it's more structured than ideation and just writing papers. But for this group, I think those couple of papers might be particularly useful to see where our head is. But we definitely know we need to be a part of a bigger problem solve here. We don't have all the answers for how to make this right.
Fantastic, thank you. And maybe the last question we'll take is, and then we'll let you get going to then introduce Harlan, is around sort of mental health and working from home issues. So obviously the question is sort of, is Google working on trying to figure out how to help mental health for everyone working on the globe now, working from home and dealing with all those stressors? It is not
it's not a significant area of priority for our work for the community, with the exception of the fact that we certainly, especially using platforms like YouTube, and when there was the big stay-at-home push a few months ago, tried to build content that would be supportive and enabling, especially for some populations like seniors. But I just will reflect back to you all that for Googlers, we have about 120,000 employees around the world, and as technology savvy as our company is, and as accustomed as we are to working remotely and asynchronously, it's been a strain. And so I can only imagine what it's like for companies that are much more accustomed to being in person. So I think for us as a company, from a workforce standpoint, we've been trying to decrease screen time. Like, sounds familiar, right? Think about how to build in breaks, do a lot with the ergonomics, figure out how to give people rest days or reset days, and to have no meeting weeks. But we honestly are still trying to navigate it, especially given that we're working home till September. And for some employees, it's been great because they didn't have to commute. But for others, like especially our engineers, when they're doing coding, many of them like to be in the same environment. I will just say, learning from virtual hackathons like yours, we think will be a great opportunity, because clearly people are learning to code at a distance, and maybe the Silicon Valley approach of always being in person can have some flexibility to it. So I wish I had a more concrete answer. We definitely know it's a challenge. We're trying to help provide good information and be helpful where we can, but also looking for how to help our own folks navigate these next many months, which I anticipate will be somewhat intense.
Well, thank you so much for taking some time to join us. And I think hopefully you've inspired the people on this call, and the hundreds of people who may watch this, or probably sleeping right now, who will be back tomorrow. There's a number of people internationally. We have 6 continents represented in so.
My goodness, that's great. You just got to get Antarctica on board.
That's right.
David, thank you so much for thank you for COVID got there, so we could get there too. Thank you for having me, and Harlan, and thank you for letting me step into your time.
That's right. So, okay, thank you so much, Karen. So I'm going to introduce Harlan Krumholtz. We're going to march on through here. So Dr. Krumholtz is another person who needs no introduction, but I will give one anyway. So Dr. Krumholtz is the director for Center for Outcomes Research and Evaluation at Yale. He's also the Harold Hines Junior Professor of Medicine and Cardiology, and the professor in the Institute for Social and Policy Studies of Investigative Medicine and Public Health at the Yale School of Medicine. Harlan has, there's many accolades for Harlan. I'm trying to think about, he was the head of National Clinical Scholars Program, or the Robert Wood Johnson's Clinical Scholar Program. He is a distinguished honor member of the National Academy of Medicine. I think most appropriately during COVID, started and helped found MedArchive, which has become really a lifeline in getting information fast and preprints in medical information out into the world. That's just some of the many accomplishments that Harlan has, as well as running the Yale University Open Data Access. So without further ado, Harlan, you can take the stage and unmute yourself if you're there. Thank you for being patient, and I apologize for going into your time a little bit.
Great, thanks. It's a pleasure to be here. Congratulations. I thought, this is the best hackathon ever. I mean, to be able to have people across the world for us to show an example of what it's like for people to meet each other, collaborate, not care about borders, but just care about ideas. Seems to me like this is the kind of hackathon that we should always be doing, where we're not bounded by who's next to us, but that we can reach across the world and share and inspire each other. So anyway, kudos to you, David, and the CBIT team, and for your own innovation and agility and thinking about how to continue the tradition of the hackathon in an era where we're facing such immense challenges on all sides. So anyway, it's amazing what you guys have done, and I'm buoyed by the number of people and the thought that people are here from all the different continents, and the people have joined together. So I thought I would just reflect a little bit on hackathons. I don't have any other agenda than that. I was fortunate enough to be invited without having been told what to say or to have a certain agenda about it, but I wanted to just share some ideas. And so for me, I just want to say that I love the beginning of a hackathon. And I say that because, there's an air of anticipation and expectation. I wanted to talk at the very beginning. I wanted to be here on Friday because it was a day where anything's possible. And it's a moment of all these possibilities that can happen. And it's I don't know, an optimistic moment. It's important to think about, though, that these hackathons, it's not a lottery. I mean, meaning that you're not here for enrichment, except for enrichment of ideas and for connections. And it's about the process where really it's an idea that everybody should win. I mean, it's great to see Jasmine and Let's Diversify what she's put together is just outstanding. And I'm always so impressed when I talk to her and hear about it. But there's always lots of people at a hackathon, and that there's one person or one group that wins. It's just part of a competition. But the real thing is to try to just be together and to generate ideas. When I think about a hackathon, I don't think about it as like a sporting event where you're doing the teams and teams are all competing against each other. I think of more of a hackathon as a catalyst. It's a catalyst for ideas and your own creativity. It's a catalyst to move, and it's a catalyst to lean in and try to solve. The other thing is that as a hackathon is a start, as someone who's been involved in 2 startups, I often think back, to the beginning and having no real idea of what it takes to make something successful, and the number of hours and the dedication and everything. It's immense. But the thing about a hackathon is just to think of it, it's a start. It's a start. It's a start where you can begin to put together what might be an exciting set of ideas, and even take it further into what would it be like if it really came into being and did something. Hackathon's really about a dream, and dreaming big, dreaming real big, because you want to have transformative impact. And so what would it take? What would it take to have transformative impact? And recognizing that transformative impact starts with small steps. It starts with proof of concept. It starts with ideas that need to be tested. But where does that bring you in that? And so an opportunity for dream. Hackathon's about promise, the promise of what could be. It's also about a dissatisfaction with the status quo. Anything that stretches from health equity to the effectiveness in the system, to its efficiency, to the patient-centeredness, whole range of properties of this healthcare system that go unfulfilled. And since we've got a worldwide audience, globally goes unfulfilled. We know there's far too much suffering in the world, suffering that could be preventable, suffering that could be mitigated, suffering that could be stopped. And there's far too little well-being, where we're actually promoting the positive attributes of health. And so there's no end to the kind of good works ahead that we could do. And a hackathon is about the promise of being involved in something that could have that kind of effect. And then a hackathon is about a connection. And I'm going to just come back to this, but it's the notion of the whole reason to do a hackathon is to meet other people, and not for the purpose of a pragmatic networking so that you can climb any social ladder or that you can, it's not anything more than connecting with other people who might have a common purpose, to try to find some way that they can do something that in the end will help other people in ways that will be tangibly important, and that you can get strength from those around you. You can give strength to those around you, and you can give encouragement, and you can receive encouragement and be part of a larger community. Now, another part of all this is about the innovation, and that tends to be even an overused word. And so let's break it down a little bit. So for me, the excitement about all of you and the idea of bringing all of us together is the idea of orienting us towards problem solving. And I've often thought and have said that it's really the spirit of a hackathon we want to promote, which is in everyday life, people are constantly problem solving. They're not walking by something that they know needs fixing, but in their minds, they're starting thinking about, like, well, how could that be fixed? What would that require? What's missing? And again, sometimes those are small things that no, they're not going to get a company or or a major big solution. It might be just leaning in for something that only takes a small amount of time, but can fix something that's in front of you. I mean, it's even whether there's a culture of, you see a piece of trash on the ground, do you pick it up? You see something broken around you, do you try to fix it? Are you so entranced by what is that you can't imagine what could be? And the hackathon is about shaking you a little bit, getting you to think differently, getting you to question the status quo, getting you to be a little bit of an iconoclast, where you don't just accept what other people tell you as being the truth. You want to try to find your own truth. You want to try to determine what's possible, and you don't want to know what the bounds of that possibility are. In fact, you want to keep pushing up against that. And then the innovation piece is about fostering that creativity, that getting out of the trap of seeing the world the way everyone else sees the world and just marching through the way that everyone else marches through, and thinking about that, maybe the way this system was set up isn't perfect. Maybe it doesn't serve everyone in the best possible way. Maybe there are things I can be involved in that could make this better. And what would that take? And it transitions from the creativity, what's the spark of ideas, to the engineering side of it and the execution side of it. Because all these ideas, no matter how creative you are, mean anything unless we can now translate them to application. There are plenty of good ideas out there that, by the way, could improve substantially people's health, mitigate their suffering, eliminate their suffering, make the system work better, that we just don't even apply well enough. So the whole side of the implementation science, the engineering of these solutions, their execution in actual practice, getting them where they're needed and having them have the kind of effect they're capable of, that's an entirely also important and different issue than the actual creativity in the beginning. And you've got to bring those together. That's where the innovation is. And that requires teamwork. And ultimately, the best innovation I've ever seen is always about teamwork. It's never about one superstar coming up with a great idea, but it's about a bunch of people coming together and solving a problem and bringing together complementary skills so that they can help each other bridge areas where each other is weak, and even bring new ideas to people who may be in a field but are sort of trapped by the conventional thinking within that field. Now, I think that, just to say a few words about what success takes, in my view, it starts with having a purpose, the right purpose, because no success is achieved without a tremendous amount of determination, a sort of can-do spirit that can't be denied. And that, I think, grows out of a sense that this isn't just for me, or even it isn't for me. And I want to just really push the idea that this isn't really the path that you should be thinking about, that's going to make you rich or get you to be one of these companies that, immediately bought out. And it's not about that. And especially in healthcare, it's not about that. The purpose has to be a drive to make things better and to make things better for others. And it's that purpose, I believe, that can lead you to the kind of success that's necessary and drive the kind of persistence that's simply required for you to be able to be successful in making a difference in people's lives. Success is also going to be about agility. Almost every successful endeavor ends up pivoting once or twice or a million times as it starts to find its way. Being involved gets you in the game, gets you with the possibility of success. But being attuned to the signals you're receiving helps you understand where you might be able to make the most progress. What's the adjacent possible? There was a sociologist named Kaufman talked about the adjacent possible. You may want to go to the moon, but what's the adjacent possible? What's the next thing you've got to do in order to build towards that larger goal? It's also about iteration. You've got to be willing to iterate on whatever you work on. And that's part of what this weekend is about, an idea that gets iterated, feedback, cycled, as much rapid cycle as you can to be able to get to something that ultimately is worthwhile. And a humility about the ideas that you have so that you can recognize what it takes to kind of iterate to get to what you need. Do you get a product market fit? What is it that people want? What is it that they need? And sometimes you're going to be coming up with something people don't even know they need. But you've got to be able to walk that line between, well, if they don't know it, how good is it? What is it? How does it fit? Now, this gets to this final success thing, which is you've got to be tuned in and hear, but you also have to know when not to listen And I only say that guardedly because I want you to listen and learn as much as you can. But there is a point where people tell you what you can't do. And you've got to be willing. You've got to be willing to have the courage to know when maybe you shouldn't listen so carefully to what other people are saying. And this is a really big judgment call, because you've got to be able to know when that point is, but you've got to do it with humility and recognize that you are listening, you are aware. And so, you can be led astray. But I don't think that there is a group that's been able to succeed with transformative change who didn't at some point have to filter out people telling them that it was impossible, people telling them they couldn't do it. Now, you've got to apply judgment. I want you to listen, but I also want you to have courage and know where there's that difference is. And sometimes the why, the purpose, can help you get back to first principles. Why am I here? What are we trying to do? And based on what I'm hearing, where should this take us? But I got to go back to the why. Who am I trying to help? What is this solution intended to try to do? And how can I get there? Now, you guys are at a hackathon, and a lot of this can be applied, by the way, in for-profit, not-profit sectors. I want to just say a word about the for-profit side. When I'm an academic, I've been in academic life my whole professional career. I was surprised when I started leaning towards getting involved in things in the for-profit sector. I mean, it wasn't my natural inclination at first, because my mindset wasn't quite there. And I started to realize that there are certain things for which we can toil in academia and write papers and try to get people to pay attention to us. But in order to really get to the point where it's sustainable and scalable and providing the kind of solutions at the kind of level of impact that we really want, sometimes that has to occur in the private sector. You may need capital. You may need to be able to be in a position where you can hire and scale in ways that are very difficult in a nonprofit world. And these are complementary worlds. It's not like you have to be stuck in one side or the other. But I am saying that in the end, you want to measure success by how big an impact you've had. And so whether you go one direction or the other, there's no judgment there. But you've got to be able to be clear, why am I doing this? In one of the companies I started, especially, it was the first time gone on the for-profit side, the decision was, if this thing doesn't produce value, if it can't be sustainable because it's afloat, maybe I should think of another idea. That it was going to want it to depend on charity. I wanted to be able to show that it could drive value in its own right, and that it would be worth it. It would be worth it for that. A couple other things just to say, the role of risk, as you all get into these ideas and then think, what do you want to take something forward later? You've got to figure out, what's the risk? What are you willing to risk? Whose risk is it? Some of you have other responsibilities, you have jobs, you have to think about the time you have available. But I can say that, some things are worth the risk, and you can make those choices. So finally, just to say, the most important thing in your lives is your time. And so you've got to be thinking about the prioritization. And I'll just focus on the hackathon. I was thinking 600 people spending about 20 hours. We got about 12,000 hours of people power here. That's a lot of people power. That's like 6 people working full time for a whole year, but it's spread among an immensely talented group. So this group's got to be thinking, what are you going to produce? And what path are you on? And how can you all each individually make the most of this? But what can you do together at the end of this to be able to have contributed to each other, which is, I think, the most important product of this. The degree to which you've helped each other on to get excited and stimulated on different paths, whether it's what you worked on here or what you're going to work on in the future, but that investment in each other mattered. And then what else have you been able to do in terms of being able to foster ideas and share those ideas with others and think about what it is that you might be working on in the future. I will say, I think a hackathon, there's a certain spirit of a hackathon, like I said, that should go beyond this. This hackathon should live on throughout the year, because you should be taking that spirit of problem solving, teamwork, accountability, vision and aspiration, hope and engagement far beyond the walls of this weekend. And you want to be able to spread that to others, that, hey, you guys are superheroes. You're problem solvers. You want to be part of making the world better, and you want to do that. So make this weekend count. You can win by being here, and you can win by opening your mind to a lot of new ideas, things you may not have considered before. And you can win by leaving with a renewed commitment to make the world better, by creating the ways that you can reduce suffering and promote well-being and make a positive difference in people's lives. Like I said before, my final advice is invest in the people around you. That's, by the way, good advice anytime. And it's good advice for the people who are around you, your family, your friends. This weekend, you're with a lot of new people. In the wonders of technology, you are virtually connected. Invest in the people around you. The more people you can meet, the more you can learn from each other, the more you can strengthen and help each other, the more successful this hackathon will be. It's not about whether you came up with a magic idea that's going to go IPO in 5 years. This is about whether or not this weekend you've been able to connect with others, get excited about ideas, help understand your own path, and figure out what you need to do for the future. So best of luck. Have a great weekend. It's a pleasure for me to talk to you, and I'm excited to see what you guys do this weekend. So thanks so much.
Arlen, thank you so much. That was fantastic. Maybe just time for one or two questions, and then we'll actually skip the break in terms of timing to get to the logistics a little bit. But Harlan, I guess the first question I'll start with while we wait for some questions in the chat room. But so you mentioned some of the barriers to implementation science and to the actual, that from an idea or from actually even very good pilots to get to the actual, masses and to scale, there's lots of blocks, certainly in public health and medicine. Do you think that big data and sort of, this is a hackathon around data and sort of real world evidence. Do you think that the explosion of big data will help us to sort of catalyze and accelerate some of the adoption issues, or will we still be limited by sort of hurdles to implementation?
Yeah, I mean, I think the bright, shiny object of big data can deflect our attention towards where these solutions are directed and who's going to use them for what reason and how they drive value. So to date, I would say that our work in big data has underperformed. And, I think Karen could talk about this, with all the might of Google and all the Google Brain stuff and all the work, for example, even with the NHS, you show me how many lives have been saved so far by all this work. And so we're still on the cusp by the capability on the big data side with where's the value of that information? Who's going to make a different choice? Where are we missing something where this information is going to actually save lives? And so I would just suggest to folks that you've got to be technically expert and you've got to understand the power of big data, but be sure you're asking the question, who's the customer for the output of what I'm going to produce? And who's going to benefit? And draw it on the whiteboard. Exactly, where does this go so that ultimately I can measure somebody's benefit and who's benefiting from it? And I think we have to anchor ourselves in making sure that we're asking the right question. And again, in a way, it's product market fit. I hate to say, everyone says product market fit, but it's kind of like I have to be thinking, what am I producing? What's the output? And how is that making a difference for anybody? And so then you can be thinking about, but just the fact that you've done the most amazing big data project doesn't necessarily translate into something people would value unless you actually had it directed towards an area where we are suffering now. People are suffering because they are lacking this. And now I'm giving this, and this is going to make something better.
Okay, and I'll do one last question here, which I think we'll end on, which is a great one, which is obviously from an undergrad. What's something you wish you knew in your undergrad years that you know now?
That's a good question. I've been very lucky to be around people who were always asking questions that were uncomfortable. And maybe I wish I knew that I was even given more permission to do that, that because I was always still trying to, particularly as an undergrad, trying to get into medical school, trying to follow the rules, you're trying to figure out what you need to do. And maybe I wish I knew more that it's okay to be different and to think differently, and that you don't need to necessarily, you need to follow your own track and figure out what your own path is. And there's no one single way that's best for everyone. And I think particularly at this time, we need to be questioning the things that are brought down to us. And I want to tell undergrads, in some ways, you have fresh eyes. You're not socialized into what is yet. And so in some ways, you are the most creative people around what it is we need to do, because you're still, you know, a lot, and as you know, David, a lot of what medical school, medical training, and not all, I know a lot of you come from a lot of different fields, and that's why you can help us. But there's a big socialization process that occurs where you start seeing the world in a certain way. And even as an undergrad, if you think that I need to do this to get to here, to get to this, to get to that, you know, you want to be able to encourage and embolden people to find different paths.
Wonderful. Thank you so much. So on that note, I really appreciate your time, and that was just very inspiring. So we are thrilled. Wow, that was great. So we're going to skip the break just in the interest of time to get to the logistics of the hackathon. And at this stage, there was a whole bunch of people praising you, Dr. Krumholtz. So thank you as well in the chat room. So I'm going to turn this over to our coordinators, Michelle and Jody. This is your time to kind of shine, to let us know about the logistics, about how the rest of the evening is going to go.
Thank you, David. So as we were speaking in the beginning, we know that there's 228 first-time hackers here. So our question is for, besides this your first hackathon, is if you have joined Discord, and if not, please change your screen name on here for your Discord if you did join it, and if not, please follow the instructions in your booklet. I also want to thank the committee. I know, David, you thanked myself and Jody, but we also want to thank the committee as a whole. They've done a fantastic job over the course of the few months putting this all together. And as our first virtual hackathon, we'd like to say thank you for all your hard work. And as we move on for this weekend, let's have some fun. Okay, so just a quick rundown of this weekend. If you need help, here's a few options. You can go to the announcement channel where we will be announcing step-by-step things over the course of the weekend. You can also review the frequently asked questions on the website and check your booklet for step-by-step instructions throughout the weekend as well. If you also need help, you can contact us via the help channel on Discord, and you can email us at yalehackhealth@gmail.com. In your booklet, you will also view how to submit your projects, and the information on the judging process is also available for you to view. Along with the fireside chats, they are described with their bios and their times, and the Zoom links will be sent via announcement on the channel on Discord. And here's just a screenshot of what your Discord will look like with text channels, the announcements, help, open discussion, and then all the mentors will also have their own their channels as well. So you can reach out to them freely if you need to reach out to them outside of Mentor Genius bars. And we'll start with our pitches. So we've had pitches that have been submitted before the hackathon. So we will first go through those who have already submitted their pitches, and we will call upon you if you're on the Zoom call. And if you have not submitted a pitch beforehand but do want to present, please use the chat function to submit a new pitch. And you can enter your Discord ID tag followed by your pitch, and we will call on you. All right, so our first pitch.
Okay, the first person is Jessie Munzel on the call. Would you like to give your pitch right now?
Apologies. I'm uncertain if I registered for that section. Would I be able to pass it on to the next team?
Not a problem. We'll go ahead to the next one. Thank you.
Thank you.
Okay, the next couple of people that are on this list that you are seeing right now, I don't believe are on the call, but I'm going to go ahead and call out your name anyway, just in case you've joined and I've missed it. And I do apologize in advance if I mispronounce anyone's names. Mohammed Ahmed. Okay, forgive me. If I do call your name, but it's not listed by that name in Zoom, just click the raise hand feature so that I can see you clearly and I can unmute your microphone. The next name I have is Sean Patel. Okay, the next name is Eli Osen. And then we have 4 people who are already forming their own team with the same pitch idea. That would be Satish, Ramia, Toshia, and Subha. I do not believe you are on either, but please raise your hand feature if you are. Okay, thank you very much. You should be able to unmute yourself now, Ramia.
Yes, hello.
Hello.
Hi. The pitch that I'm going to make today is about miscarriage prediction. About 1/3 of pregnant women will miscarry due to various factors like lifestyle and other parameters, health parameters. So there's a need for a sensor and an IoT technology like a smart band to analyze and predict the miscarriage and provide focused care, virtual care, and prevent them from the physical and mental stress caused by fetal loss. If you guys are interested in our pitch, please do join us. Let's work together and have a wonderful weekend. Thank you.
Thank you.
All right, thank you, Ramia. I'm adding your Discord tag to this. And the link to this should be available in Discord very soon. So if you do see something that's incorrect or that you want to update, please feel free to update that. All right, the next pitch idea was from Sneha Jivan. Sneha, are you on? I thought I saw your name. Perfect, thank you.
Hi everyone, my name is Sneha Jivan and I wanted to tell you about a blood testing device that I've been working on for the past year. So according to the CDC, 80% of people in developing countries rely on local clinics for healthcare services. However, 150 million such residents face destructive healthcare costs due to direct payments and lack of physicians and sufficient medical technology. And that not only that, the high cost and inadequate local access to immediate preventative screening services negatively affects the health of rural communities globally. A CBC test checks several measurable components of your blood in order to detect possible diseases and assess overall health. In underdeveloped countries, however, CBC testing cannot be easily implemented. I'm looking to help develop a device to replicate the function of a large-scale CBC machinery and give patients results in a much faster and quick manner. You can reach out to me, and I'd be really interested in working with all of you.
Great, thank you very much. Okay, next up, we have Vivek Talwar. I do not believe you are on, but if so, please raise your hand. Okay, going to the next one, we have Gunan Gong. I do believe that I saw your name on here. Okay. Gunong, would you like to present your pitch?
Hey, I'm Guanan. Yeah, thank you. But I already formed a team, so I will skip the pitching part. Thank you.
Okay, thank you. Okay, next up we have Abhas Sanapati. Abhas, if you are on, please raise your hand. Okay, next up we have Kelly Farley. Thank you, Kelly. You should be able to unmute now.
Hi, thanks. So the birth control pill is a widely used and effective medication if it's taken properly, yet patient compliance is incredibly low, with half of women forgetting to take the pill and a third discontinuing, mostly without talking to their doctors first. The birth control pill is taboo, and these issues are rooted in miscommunication. With hundreds of options, there's a lack of awareness of the different types, how they should be used, context for what's normal and what's not. I proposed a free mobile app that would track compliance and side effects and use this to determine the ideal formulation for the user. The data could then be given to pharmaceutical companies so they can understand what patients are looking for in a pill and what side effects they experience. This idea can be expanded from birth control pills to any other medication where there are many different formulations available. Feel free to reach out if you're interested.
Thank you, Kelly. Next up, we have Ishita Dasgupta. Okay, moving on to Jait Saha. All right, I do believe that the next several people are not on here, but I will go ahead and voice their names just in case. Ankita Kokera. Priyanka. Mulisa Krishna. Douglas Peterson, I do believe that I saw you on. Okay, it looks like Doug is no longer on. Next up, the next several people, we have Sanjit Singh, Vishva Natarajan, Stephanie Hu, Gayatri Gandhi, Yana Vasilieva, sorry. Corey Skeffington, Samay Lankana, Amanda Gao. Okay, Amanda, I thought that I had seen your name a moment ago. And apparently not anymore. Okay.
Hey, Jody.
Oh, perfect. Thank you. Irene?
This is, I just wanted to let you know that Douglas Peterson is here. He's row 20. He wants to make his pitch.
Perfect. Hold on one moment, Douglas. Let me find you in the list here. Okay. D. Peterson, I see. My apologies, Doug.
Hi, my name is Douglas Peterson. I am thinking about different ways to do application of patient-level risk scores toward changing provider practice patterns. So out there are lots of different ways that you can identify effectively how sick a patient is using the patient's information that's available in the electronic health medical record, whatever medical record you're using. And we can develop predictions of how sick a patient is or what the utilization is likely to be. But once we have that utilization risk score, we don't necessarily know what to do with it. So developing an application toward that would be great. Thanks.
Thank you, Doug. Okay. Picking back up, going with line 30, Neela Nathan. Jason Tan. Charlotte Chen. Nicholas Minella. And again, just to reiterate, if I do call your name, please raise your hand so that I can unmute you.
And Jody, I'll just point out, this is David, just if you, for some reason, think that even though they're not here and giving the verbal pitches, these will all be uploaded to Discord so you can look at them and make sure to, if you find the ones, to communicate with. So even if you don't hear a verbal pitch, you can join on Teams.
Perfect. Thanks for the reminder, David. All right, next up, Kavita Nair. Michael O'Brien. Michael, I do believe I had seen your name a moment ago.
He says he's here, number 34. Let's see if he's there.
Yes, but in the actual participant so that I could unmute.
Good question.
There you are.
Hello, can you hear me?
I can, Michael. Thank you.
Hi, so my name is Dr. Michael O'Brien. I am a general internist. I do home visits here in New Haven and the rest of the state of Connecticut for a company named CareMore. What I am interested in my pitch is, what I talked about was everybody around this time of year does makes a resolution for their health, and up to 80% of people don't keep those resolutions. And yet our decisions about our health happen in our homes. Many of our homes are connected to the internet, and many of our homes have things that could get connected to the internet. And there's just a question around, is there a way to close that gap of sticking to healthcare resolutions over a long haul, over a year, over a lifetime, in your home where those health decisions are made? So that's what I'm interested in approaching that question. Thank you.
Thank you, Michael. And I apologize, that was pitch number 5. Okay. Next up, we have Srikar Sadhu. If you guys would be so kind as to raise your hand when I call your name, it would be very helpful in finding you in our list. Perfect. Thank you very much. I appreciate that. You should be able to unmute now.
Can you hear me?
Yes, I can.
Okay, thank you so much. So, I'm going to be pitching a problem called cerebral hypoxia. So patients with neurodevelopmental disorders such as cerebral palsy and ALS experience a lack of oxygen to their brain, which causes them to get cerebral hypoxia, in which their brain shuts down nearly 5 minutes after oxygen levels start to deplete. And this is a common problem amongst these patients and most often leads to death. So I already have a team, and we aim to develop a biosensor to proactively detect cerebral hypoxia and prevent them from getting it. And we're currently looking for a graphic designer who has experience with animations and design. Thank you.
Thank you.
Okay, next up is Surya Chavisaya on, and I very much apologize for mispronouncing. Okay, what about Don Chandri? All right, Don, I do believe that I saw that you were on here, but I do not see you anymore. Okay, Don must have left. Next up, we have Anish Salvi, Sambina Anita, Aninya Kumar Patro, Alexi Muyana, Amanda Perez, Aniket Dahol, Nandina Anna Thomas, Jay Coleman, Arya Joshi, Timothy Liu, Kashav Ravi Prakash, Vimig Socrates, sorry. Thank you so much. And I apologize for saying your name incorrectly.
That's okay. I assume everyone can hear me? Okay.
Yes, we can.
Hi, everyone. My name is Vimig Socrates. I am a second-year grad student here at Yale. I'm putting together a team. Currently, we have one other grad student and a pharmacy student. And we pivoted a little bit from the pitch that's written on your screens right now, but I'd like to tell you a little bit about dietary supplements and misinformation regarding them. So over 70% of Americans currently take some sort of dietary supplement every day. And so that entire industry is worth over $28 billion. But unfortunately, the FDA does not require any sort of proof either on the labeling or in the actual product itself for dietary supplements. And as a result of that, it's been estimated that around 23,000 ED visits has occurred in the US because of that. These cause anything from like cardiovascular disease to various other swallowing problems, things like that in older adults. And we propose to create some sort of consumer-facing product using external data sources and scraping the websites that you're actually on. So something embedded within the browser that patients can use to better understand the information that they're presented regarding dietary supplements and hopefully make better decisions based on these things. Thank you. Sorry, and I guess we're looking for any other developers that have some sort of skills in NLP and things like that, or other domain experts as well. Thank you.
Great, thank you.
Okay, next up we have Ambereen Nahal. You should be able to unmute your phone.
Hi, thank you. So my name is Ambereen Nahal. I'm a physician. Can you hear me?
Sorry for the technical difficulty. We can hear you now.
Okay, sure, great. So I'm a physician. I've been a medical director in the Medicaid program. I have led a 14-center FQHC, or federally qualified health center. I have an MPH and I'm getting an MBA currently. And my interest is really, so two things. One is the pitch that you have in front of you, which is thinking about, what I'd like to propose is having a way to rate existing algorithms for how well they do in different populations and, across gender, race, and settings, so we can have like a bit of a rating so that when clinicians or health systems go to buy these algorithms, they can know what kind of quality they're getting. But I am also in discussion with Shannon, who is thinking about improving diversity in clinical trials. So if I end up joining that group instead, then we're looking for a designer to join our team.
Great, thank you.
Okay, our next possible pitch is Alexi Muñana. All right, Michael Antonio. Sorry, I think I see a notification. Bear with me just one moment, guys. There you are.
Hi everyone. So we have a team and we aim to develop a wearable breathing engaging device to help people with stress and also some lung diseases to cope with breathing.
Great, thank you.
Okay, our next pitch, Jorge Luis Esponda Schombergo. Okay, moving on to Lavanya Kartikian. Salmiri Najari John. Akash Sharivasta. Joy Agus. Okay, Max Jordan and Gimiko Tiako. Max, I see you on there.
Okay, I'm here. Hi, everyone. My name is Max. I am a medical student here at Yale in my final year, and I have a background in biomedical bioengineering. Something that I've been thinking about a lot recently is that people with chronic illnesses, like say type 1 diabetes, or even acute illnesses or conditions, may have occupational concerns related to their illnesses, meaning, for instance, for someone who has type 1 diabetes, although that's a fairly common one, knowing what might be their limitations in terms of a job that they're signing up for, and whether they need some type of accommodation at their job related to their acute or chronic illness. Type 1 diabetes is one, narcolepsy is another one. There are many different types of occupations that pose limitations for people with chronic and acute conditions, and there is a dearth of there's a lack of information tailored to people with chronic or acute conditions and sort of occupational concerns. So I'm looking for folks to sort of help build an informational platform, almost like WebMD, for people with such conditions. Thank you.
Great, thank you.
Okay, next up we have Mihir Rabia, Akash Pandey, Andrew Niskowitz. Okay, I do see that you're on. Bear with me one moment, Andrew. Andrew, you should be able to unmute yourself now.
Gotcha. Yeah. So I already have a team now, so I think I'm pretty good.
Okay, thank you. How about Garrett Fullerton? Garrett, you should be able to unmute yourself now.
Oh yeah, I have a different project.
Okay, so you want this one to be removed? Okay, will do. Thank you. Okay, Mahesh E. Yusuf Iqbal. Menelaos Konstantinidis. Adiola Miriam Toy. Kunal Kalani. Yoha Gomes. Okay. How about Deep Patel? Deep, I do see you're on. Bear with me one moment. You should be able to unmute yourself.
Yes. Actually, I am not quite sure with my pitch right now. So, is it okay if I don't present my idea?
That is perfectly fine.
Thank you.
You're welcome. Melanie Hasai. Okay. It looks like Melanie may not be on any longer. Saranya Hayaranara. Oh, I'm very, very sorry. But it does not appear that you are on. Maxim Lewins. Parth Harish. Apisik Badant. Apisik, I do believe this is you. Is your with your Discord of Be His Be?
This isn't me, sorry.
Okay, thank you for that clarification. Trevor Islu. John Havlick. Okay, John, I do see you on here. You should be able to unmute yourself now.
Hi, yeah, thank you. Okay, cool. Yeah, so my idea is not the one on the screen, because I looked again at what the hackathon was kind of focusing on, and I like the economic forecasting side of things actually. As a med student myself, a lot of med students have gotten into healthcare outcomes research because it can be done kind of like remotely because of the pandemic. And there's a lot of cool things about healthcare outcomes research. One of them is that you can sort of predict like the average cost of someone going in for, say, a knee replacement or a hip replacement. But the problem is insurers basically reimburse at super different rates. So like you can have Medicare reimbursing at like, I don't know, $8,000, where you can have like United premium healthcare plan reimbursed at like $16,000. So when someone walks in the door, you're not really able to get a nice narrow range of how much you think the hospital will end up collecting from that person. Now, as of January 1st, there's a new law that basically makes hospitals say how much different insurers owe. And basically, if you can combine that with existing outcome papers, you can have a much better model for hospitals of what people will pay for certain procedures. And I think this could be a super valuable innovation for those hospitals to basically predict what they will collect on certain procedures for billing. So our team is pretty good right now, but if you're interested, we are always open to having, one or two other people join who sort of understand outcomes research and maybe understand a little bit of website development. Cool. Thank you for listening, everyone.
Thank you, John.
Thank you very much, John. We do have some more that have already put in their pitches ahead of time. So we're going to call on you first, and then we're going to go and take new pitches. If you do have a new pitch idea, please type it in the chat. Okay, next up, let's try for Elvis Cow. Ivanov, excuse me. Halak Shah. Ilya Schlechter. Anjali Srigadhan. Rowan Aluya. Charles Shu. Okay, and then we have what appears to be a team already. We have a couple of names, and it looks like all of you may be on. I'm going to go ahead and unmute this for the first name, Akshansh Bob. Oh, no, thank you very much for letting us know that. Bear with me one moment as I unmute the right person. All right, Akshat, you should be able to unmute yourself now.
Hi. So, we have been working on a project for like very long. It's about like a year or so now. So it's about the mental health of teenagers and working on the anxiety of teenagers. So as for like the problem that 1 in 3 teens around the world face anxiety, and 80% of them do not get the proper treatment. And that's because there's a lot of stigma in society, and people are not very open-minded about the topic. So we aim to remove that stigma and also make society be more open-minded about it, and also support people be more open about it. Yes, so that they can share their problems.
Thank you very much.
Yeah, and also if you would like to see more of our work, you can check us out on sparkthespirit.in. That's our group name. I'll post it on the chat as well.
Thank you. Okay, next presentation, Luciana Dantas. David Pindris. Javier Ramiro Pavera Figuera. Thank you for raising your hand. Okay, there, you should be unmuted now.
Thank you very much. Mihalis previously said the idea that the group has. I am part of the group of Mihalis.
I'm so sorry, Javier. I think my sound cut out and I missed part of what you said. I apologize.
That Mihalis previously said the idea that my group has, because Mihalis and I are part of a team.
Oh, okay. Understood. Thank you very much, Javier.
Thanks to you.
Okay, next up we have either Gennaro Apuzzo or Carlo Russo. No, okay. Jadine De Jesus. All right. Rohim Alihaya. Thank you for raising your hand. You should be able to unmute now.
Hi everyone. The topic is breast cancer. Breast cancer is most common cancer in women, and when the breast cancer is detected early and it is in a localized stage, the chance of survival is about 99%. Using the platform that we plan to build, a user can enter some of the information, and the platform, the tool will return the chance of getting breast cancer for that individual. We are already 3 people on the team, but we are open to have one more member, someone with knowledge of D3 or JavaScript would be great. Thank you.
Thank you.
Okay, I don't believe the next several people are on, but I will go ahead and say their names quickly just in case. Ishan Chadha, Apurv Shakar, Pierre-Antoine Bastian, Jose Alexandra Gomez, Naman Tuli, Mirgangshi Kapoor, Neural Balgat, Anurd Bahiraju. Okay, Sankha Srikanth. I believe that I had seen your name on here a few moments ago. Yes, okay, bear with me one moment. You should be able to unmute yourself.
Yep. I actually, can you hear me?
Yes, we can.
Yep. I actually found a team. So I would recommend you to move on to the next. I actually found a team.
Okay, thank you very much. Madhav Chopper, RT Kumari, Kevin Gibshayan, Sanjay Anathanamarayan, Siddhant Siddhani, Emma Kilizatug, Kevin Givichan, Bradley Anderson, and Arnav Walia. Arnav, I do believe I see you there. Perfect. Thank you for raising your hand. You should be able to unmute.
Hi, everyone. So we have a few team members in mind and connected. So our idea is for a device related to dialysis. Chronic kidney disease is basically a problem that impacts around 10% of the population and represents around $300 billion in annual healthcare spending in the US alone. So the majority of these costs are not due to dialysis itself, but they're actually due to preventable hospitalizations in dialysis patients. And a lot of these preventable admissions represent a cost of over $55,000 per year per patient, and that's just the Medicare spending alone. Now, fluid overload and other associated conditions are responsible for the plurality of these hospitalizations, and these often incur high but preventable emergency room costs. And with an adequate warning time before an episode, patients can be treated more efficiently in outpatient clinics or even treat themselves at home with existing technologies, and that's already widely done. Our team envisions an implantable device employing big data solutions that can help mitigate this problem. So please feel free to get in touch with us, and thank you.
Great, thank you.
Okay, Jesse Cohen.
Good evening, everyone. My name is Jesse Cohen. I'm a physician that specializes in the care of nursing home residents. Most of my patients have Alzheimer's, and one thing that you'll find if you research Alzheimer's is that about 10 million people or more in the next decade are going to develop Alzheimer's in the United States, and that's going to be multiplied globally. Most of those people right now have mild cognitive impairment, which are the early stages of the disease. But most of those people don't know that they have mild cognitive impairment. So my pain point is trying to identify the people that have mild cognitive impairment so that we could potentially give them two of the known scientifically validated interventions that have been demonstrated in the Pointer trial and the Finger trial over the last couple of years to intervene on mild cognitive impairment to stop them from progressing into Alzheimer's disease. We'll use that potentially as a way of focusing advertisements with either public health or the private sector. Thank you.
Thank you.
Thank you, Jesse. Okay, Derek, you should be able to unmute yourself now.
Okay, can everyone hear me?
Yes, we can.
Okay, great. All right, so I'm Derek Wilson Duncan. I'm a software engineer. For my idea, I'd like to pitch a smartwatch application that helps dietitians keep track of the biometric data for their clients. So, a lot of people who are, pre-diabetic or suffer with, conditions that make it difficult for them to maintain or, keep a suitable weight. It can be, difficult for them to, track, what they're doing, in terms of, how much sleep they get, what they're eating, how often they're eating. And with some of the information provided with, smartwatch applications, that could be helpful for dietitians, drafting up a game plan to help them, figure out how to lose weight. So I'm looking for a designer, another programmer, and hopefully someone that's a subject matter expert. But, anyone's welcome to the team.
Great, thank you.
Okay, the floor is open. Are there any other pitch ideas that anyone has that they would like to give? Okay, Parker, thank you. We are going to ask that you guys put your pitch ideas in the chat so that we can easily copy and paste into our master document here.
Okay, I'll copy it right after I talk. But so my pitch idea basically is a key card that you can fill out at home on your computer. You bring that in when you go to the doctor's office, you swipe it, and that fills out all your information. It can have your insurance. It can also translate it. So if you're in another country that doesn't speak your language, therefore all your medical information could be immediately transferred. This would also be useful in emergency settings for if you're unconscious or unable to give them your information, your pre-existing conditions, like what your allergies are, or if you already have like broken bones or something like that, then the doctor knows in surgery, hey, this person already has a broken leg, this is a pre-existing condition, they can treat you accordingly. So it's also an emergency while also an efficiency method as well.
Great, thank you, Parker. Okay, next up we have Niti. Bear with me one moment, Niti, let me unmute you.
Yes, hello, I'm Niti. I'm pursuing my master's in biomedical engineering. So we're a team of 4 and we're working on a modular kiosk with diagnostic capabilities that can send the patient's real-time vitals to doctors for remote diagnostics and to enable checkups and maintain health records digitally to provide preventive and non-emergency care. So if that sounds like something you'd be interested in, please feel free to hit us up. Thank you.
Thank you very much. Okay, do we have any other pitches? Anyone else that has an idea that they would love to present to either form a team or to add to your team? All right, Shrey, thank you very much. You are able to talk now, Shrey.
Hi, everyone. So my name is Shreyoshi, and I'm a researcher in the field of in pharmaceutical industry. And I actually wanted to pitch an idea for the field of immuno-oncology. So just within this field from 2019 to 2020, there is a 22% increase in the drug development, and overall, within the last 3 years, there are 233% increase overall in drug development. But these clinical trials are missing a rational or a systematic framework to maximize the trial's efficacy without exposing the naive or new patients who are not on the PD-1 or PD-L1 treatments to develop drug resistance during these trials. Also, the downside is the trials costs are increasing and there is a limited infrastructure to support these. So actually during this hackathon, I want to brainstorm about developing a system using machine learning approach to create a structure that can take into account patients who are naive during this treatment and actually to build a prototype based on this concept. This will also ensure on like how to maximize the outcome for these trials and minimize the risk from patients in.
Awesome, thank you. Okay, the floor is still open. We can take some more pitches now. I want to give it just a couple of minutes before we dismiss for people to go ahead and continue their networking and chatting and getting started on projects. We will have a few closing remarks. Oh, hold on one second. Brain Lab, okay. Bear with me one moment. I will get you unmuted.
Yeah, hello, can you hear me?
Yes, we can.
Yeah, I had some problems with copy paste. Basically, my name is Andre, and our team. So we have almost team, and what we want to make something for patient care, and just some number to think about. That it's about more than 1% of the people that have problems of hearing, and probably if you're participating in this video conference, you have no problems with that, but it's more than one problem of people have this. And imagine you come to the hospital, you cannot hear and you come to the hospital and you need to receive care. And it's quite problematic. And usually people try to read lips, but now with masks, you cannot do that. So what we want to use to help these people, we want to use smart glasses to help them so that they can basically read what you are saying. So the text is visualized into the glasses, which can very much simplify the taking care of these people in the hospital. Right. So what we are looking for, we look for the people who are who have experience in patient care or have experience working with patients with disabilities, like hearing impairment. Right, or someone who is maybe excited about augmented reality, or maybe have augmented glasses and want to implement something with that. Okay, thank you.
Thank you very much. All right, we still have time for a couple of more pitches if anyone has something that they would like to present at this time. Okay, Rebecca, I see you there. Bear with me one moment. I'll unmute you. Before I have Rebecca talk, I just want to let you guys know we are going to reconvene tomorrow as a group at 9 a.m. to review these pitches that are here and allow for anybody who's thought of something overnight, if they have a new idea that they want to pitch as a project for this weekend. In addition, this spreadsheet that you're viewing, a link is going to be made available to you through Discord if it has not already. So that you can see what's on there. If you see a correction that needs to be made, just let us know through Discord and we'll make that change. Rebecca, I'm going to go ahead and unmute you now. You can go ahead and give us your pitch.
Hi, so my name is Rebecca and I am a master's student at Johns Hopkins in the Bioengineering Innovation and Design program. And this is something I just came up with right now as we were listening to kind of everybody else. But a big problem for dialysis patients is actually adhering to their very, very strict diet. And if they eat too much of different types of things, it can severely affect their dialysis treatment effectiveness, as well as actually be potentially deadly, specifically if they have too much potassium in their diet. So we propose some means of allowing them to better keep track of their of the things that they're consuming.
Great, thank you.
All right, that was great. Do we have any last pitches for tonight? Just want to give it a moment. I don't want to cut off anyone too soon. Okay, I'm going to guess that a lot of people are very eager to get started and working on their teams. I know you guys have a couple of different mechanisms you've been using. Discord, of course, is going to be the primary method we're going to use to contact you throughout the weekend. I know Michelle's already talked to you a little bit about some of the schedules. The next steps to be mindful of is that we are going to gather here again tomorrow morning at 9 o'clock in the morning. Like I said, that link will go out through Discord. If you have not yet set up your Discord account, please do so as soon as you step off here. It will be crucial. Your teams will have to register as a team tomorrow by 11 a.m. All of this information is in the booklet that went out to you. So read through it. It's a lot of helpful information. And we are excited and looking forward to meeting with you guys more tomorrow.
In the meantime, if you need to contact us, you can send us a message on the help channel, or you can email us at yalehackhealth@gmail.com. Thank you, everybody, for tonight. It was great and awesome, and we got a lot of pitches and a lot of spontaneous networking and team collaboration in organic team formation. So we look forward to speaking with you guys tomorrow.